So Dr. Dar, basically, she does no physical exam, and she claims every part of the physical exam, which is incredible. Even the section that says genitalia, she says she did that work, and she says no hernias. Now, obviously, I had my shorts on the whole time. Now, that's the other thing, really. Now, I had like a bigger pair of shorts, but basically, I was in my shorts, and she's supposed to do the physical exam, and the way it works is, after the physical exam, I'm supposed to put my clothes on, and so the physical exam lasts like 5 minutes, and then my clothes are supposed to go on, and then we are supposed to talk. But instead, because she's such a crook and she's up to no good, she completely does not realize, or it does, because she's so much up to doing something wrong, that the entire time, like 50 minutes, when I'm sitting there and talking with her, and she's just deflecting everything I say, I'm basically sitting there in a big pair of underwear, basically. That's all it is. So I pointed out that that's very wrong, that the patient shouldn't be discussing anything with a doctor while he's basically sitting in his underwear for 50 minutes, and the doctor is not conducting any kind of a physical exam, that once the physical exam is over, he should wear his clothes. But I think Dr. Dar was trying to figure out what to do, and the whole 50 minutes she never did any physical exam, and I just ended up sitting in my underwear the whole time. And on top of that, she also knows from my records that I have that really bad problem with my upper spine, and that became really bad I really had a lot of spine pain for a couple of days after Dr. Dar, because I had to basically sit up without the back being supported for 50 minutes, while all she did is lied and deflected everything that I said. So anyway, getting back to those records with Vicky, so when I got that's incredible. So I got the records from Vicky, and that's where I found all this garbage in the records. And that's what's incredible is, because Dr. Dar really didn't even touch my body, that she didn't even notice that I had a fever. So I had a fever and a hoarse throat. It's not really at the throat, it's below the throat. That's when you have a lot of heart conditions. Yeah, you get hoarseness. So I guess you can hear it right now. Well, I have the hoarseness like down below the neck area, so in my upper chest. So I had that, and I had a fever to go with it. And Dr. Dar even wrote down on the records, patient denies records. Well, Dr. Dar, shouldn't you know if the patient has a fever? I mean, it's not like a thing where a patient denies. You check if the body is warm. You know if the patient has a fever. So what happened is, Dr. Dar's exam was like on October 15th. Then I got the records like in about November 7 or something. And then like November 12, what happened is, because that fever was still not gone, because Dr. Dar didn't find and treat it, I had to go to the MedStar Express, kind of the urgent care center, and they took care of the problem really well. They gave me an antibiotic, which is literally the absolute cheapest antibiotic, amoxicillin, So that fucking bitch Dr. Dar, if she gave me the antibiotic a month ago, the problem would have been solved, and I would have never gone to that other place. See what happens, Dr. Dar? When you're such a liar, this is what happened to Innova as well. Because every lie they told, somehow it turned out that because they told a lie or they did something like a misrepresentation, something good came out of it for me. So in fact, Dr. Dar is the one, when I just wanted Dr. Dar to get my records from the other providers, she sent me to her records office. Hey, and then I said, hey, well, Vicky, you're like the records person for Dr. Dar, so why don't I just go ahead and get my records? So I would have never even decided to get my records, because I knew Dr. Dar did awful work with me that day, so I wasn't even going to get my records. So, but since, she set me up with Vicky, I said, get my records. Then, on top of that, because she didn't take care of that fever, and she lied her ass off on my records, so when I went to that the other place, my records apps actually showed up there. It's like a quick version. It's the problem list, right? So if you look at the problem list, man, it makes it look really bad. Okay, I mean, for what she's because really, what I had. My main two problems was the aneurysm in the ascending aorta, which is as severe as any heart condition. And that problem, if it's confused with like a regular fat slob heart attack kind of thing, they do the things the incorrect way in a hospital, and they actually make the condition worse, and they can actually even kill you, right? So it's not just a matter of the problem not getting treated and not being seen in time, but you actually get injured and killed by that. So Dr. Dar did that to get me injured and killed. Then the other problem was I have this problem where caused by the verapamil, and that was done by Innova, and that harm was where my heart wasn't I guess beating enough and giving enough blood, and really my entire heart basically is like an engine being entirely without oil. So my entire heart is being drained of blood and having no blood at all. So that condition is not the same as being a fat slob and your arteries being clogged with fat, right? So there again, that's another very severe heart problem, which if I go to the ER or something, I want to make sure that the problem which I have is the one that's being taken care of, not this garbage Dr. Dar set me up with. Dr. Dar, and what I found out with Dr. Dar is, Dr. Dar, I never I never gave Dr. Dar the full records from Innova. So Innova said that they prescribed the verapamil for migraines, even though I didn't have any migraines. So, but what I told Dr. Dar is, and which is what I've told other doctors, that the verapamil was prescribed for high blood pressure. So that would have been a much more legitimate reason. And then, but she called Innova unauthorized. I did not authorize her to contact Innova. Otherwise, she would not have found the significance of migraines. So what this bitch Dr. Dar did is, so what it looks like is, in my records she wrote migraines all over the place, even though I didn't have a migraine since like 2004. So you know how and then on the problem list, which is really bad, because the problem list is what showed up at MedStar Prompt Care at Wheaton. Now, if I went to the emergency room, that same freaking problem list would have shown up. Now look what it shows. Now the problem list, the first one was pharyngitis. That's pharyngitis acute. Now that's the problem I had that day at Prompt Care. Then this fucking bitch Dr. Dar puts obesity, even though she knew that's edema. Then what she did is she put family history of ischemic heart disease. Now that really refers to like the fat slob problem. So, and we discussed it in the office with Dr. Dar during the visit. And I told Dr. Dar my father had an early heart attack because basically he was a fat slob. And then after that, he controlled his diet and exercise and he didn't have a problem. And my grandparents all lived into their 90s. So, I don't have any genetic predisposition to heart disease. And also, this ischemic heart disease is talking about the coronary, the heart actually being clogged with plaque. So she's setting me up as a fat slob. She wants to lie about what Innova did. Innova actually caused a heart injury that's giving me the heart problem worse than being a fat slob. Then she goes the hyperlipidemia, the high cholesterol. It's not high cholesterol, Dr. Dar. My ratio was normal. My LDL was elevated. Get it? My LDL. Now, and then she goes abnormal glucose. Again, the abnormal glucose wasn't even elevated. The glucose wasn't elevated. It was just the hemoglobin A1C was a little bit on the high side of normal. But even that, the cholesterol and the glucose, don't you think, Dr. Dar, if my heart is completely starved of blood, that I should eat a little, you fucking bitch? What the fuck? Think about it. She's basically telling me that I can't eat if my heart is completely drained of blood. Yeah, you're crazy, Dr. Dar. You're a lying bitch. And then, the only symptom, I guess, what she put normal, which I did complain, and she put appropriately, was the shortness of breath, dyspnea. Then that lying bitch, she put in a headache on my problem list. You know why? Even though I didn't complain of any headache, or I didn't have any headache diagnosis since 2004. She puts the headache diagnosis because because she found out. Without that contact, I told Dr. Dar I was prescribed it for hypertension. I didn't tell her anywhere, because no one would have imagined that I was being prescribed verapamil for migraine or headache, 10 years after I had my last migraine. It's crazy. So anyway, so she went ahead and she put down headache on my problem list. And the reason she put headache on my problem list is so that it would justify that other doctor's action. So when I say Innova did not have a right to prescribe any medication to me for headache because I didn't have any headache, well, it's here on this bitch Dr. Dar's list. I have a headache. Okay. Then she put sweating. Okay, that was fine. That was fine, but still, if she didn't describe it in the history exactly how the sweating comes, it's not like I'm getting nervous and sweating. I pointed out my palms are perfectly dry, and my sweating was basically in the chest. And then she put numbness of the hand. See, now that one, now here's the thing. The family history of heart disease, ischemic heart disease, the headache, and now the numbness of the hand, these three were not in the records that Dr. Dar gave me. So Dr. Dar gave me the records, the records from October 15, Dr. Dar gave me like in November 10. Then on November 12, when I go to this other place, so Dr. Dar went in and added these three things again. So let's ask Dr. Dar. Dr. Dar, what happened on November 10, between November 10 and November 12, where you put family history of heart disease, headache, and then the final one, numbness hand. Now, because there again, the numbness of the hand we discussed very well in the office. It was not a numbness of the hand. What I told her is, it's mainly a numbness and dizziness in the head while driving, and it makes it very difficult to drive. And it was not a numbness in the hand. So it looks like the numbness in the hand issue, the headache issue, and the family history of ischemic heart disease, those were actually 3 points that we spent a lot of time discussing and made sure that's not a problem. So I think that's why those 3 things she stuck in probably originally. Then when I asked her for the record, she took it out, and then she stuck it back in, and she didn't know that because of that fever she didn't treat, I'd be going somewhere else with MedStar, and then this stuff would be showing up. So there's 3 diagnoses that on the problem list. See, Dr. Dar, see the process. So it's not even, so the problem list, see, that's how the stuff goes, right? So it shows up on the problem list. So you know how it is. This is like defamation, You just repeat some falsehood and it goes on and on. So why is it on my problem list, Dr. Dar? So when I went to MedStar Prompt Care, they just see it's on the problem list that you have these things, like the headache, even though I didn't have one for like 10 years, I guess, and all this stuff. So she's completely misrepresenting the facts just to help Innova in a future malpractice case. So let me go ahead and continue it on to the next tape. You all have to keep hearing because I try to present it nicely and more precisely, but now I'm not going to spend my time making that extra effort. I'm just going to go ahead and just kind of say the stuff out, and just go ahead and listen to my next recording.